Good morning, everyone. Thank you so much for joining us today for another OrthoIllinois Workers' Compensation Power Lunch. I know just how busy everybody is, and we do truly appreciate you taking time out of your busy day to be with us. Without any further ado, Dr. Shree, welcome. Thank you for joining us today.
Thank you, Bill. And welcome to all the attendees. We are going to discuss the importance of orthopedic evaluation specific to workman's compensation injuries. That is specific for the attendees for the webinar, which is intended for employers, nurse case managers, work comp adjusters, HR professionals, safety directors. So thank you for taking the time today for this afternoon, and welcome. A little bit about myself and my background. I'm a board-certified family medicine physician with extra training and specialization in emergency medicine. And I've been practicing as an ER physician for the past 10 years, and specifically as the medical director at OrthoIllinois Injury Express for the last 4 years now. And every day we see injuries of all sorts, and having that background in emergency medicine has especially been useful in my practice at OrthoIllinois, and also specific to workman's comp injuries. And that is my current focus. Expertise is dealing with acute injuries and managing workman's comp cases, getting patients back and healthy and back on the workforce as soon as we can. Okay, without further ado, let's move forward. The objectives for today's webinar is we'll keep it very simple. We want to have the attendees get a good understanding of the importance of timely orthopedic care and how early treatment can help improve the outcomes in cases, and have you identify which is the right place to choose when we have injuries present to you from employees who are hurt at work. Where do you send them? Do you send them to an urgent care? Do you send them to a specific orthopedic urgent care? Do you send them to the emergency room? And give you an idea, an overview of our own evaluation process as it pertains to Injury Express, what we do, how we do it, what all we offer, and how our workflow is. And then how we coordinate with you, the employer, the case adjuster, whoever is with the patient, and with the patient themselves. How can we all work together as a coordinated approach and collaborative effort to work towards getting the injured patient rehabbed and get back to the workforce safe and early. And then again, explaining a little bit more about the importance of timeliness. Now, why does this matter? Why is this a point of discussion? Why are we stressing importance and bringing it to attention for all parties involved? Is whenever a worker is injured, right, it is not just one person that is affected. So as you see, we have the injured worker in the middle, and then we have a circle around him. That includes his family. There's financial implications for lost time, inability to work. There's emotional stress involved with regards to uncertainty. It affects coworkers, increased workload for other workers to cover extra time and workload. It affects team morale. And then there's safety concerns now, 2 people doing the work of 3 or 4. So those challenges not just affect the injured worker themselves. And then it's a challenge to the healthcare team itself when we don't do things the right way, or rather they don't go to the right place, or they don't get seen early, then things are fragmented. It affects coordinating things, making decisions at the right time, and ultimately affecting the ability to return to work on time. And for the employer, this is very important as well, right? As we know, it affects productivity, it affects the operations, and leading to increased cost as well for the employer. And then, as we know, it affects the insurance carrier as well. So it's not just one person. That's the bottom line, that when one injured worker presents, it's a lot of implications there in doing things the right way. And the data supports this too. When it comes to injured worker, musculoskeletal injuries are the leading cause in terms of lost workdays. That's about 33%. And musculoskeletal injuries account for about 37% of all workers' comp claims. Roughly 25% of productivity losses are injury-related pertaining to musculoskeletal injuries. And the big one is 70% of injuries could benefit from earlier intervention. That is the key, and that is why this matters, and that is why we're having this discussion, right? 70% is a big number, and to imagine that it could have benefited from an earlier intervention, that is why this is significant, and this is research data that is supporting this. Now, talking a little bit more about the cost of delay, as we know, timely care leads to better outcomes. Now, what does the impact of delay mean? It leads to delayed diagnosis. Injury is often misdiagnosed. We see it all the time. Just from a delay, how it impacts the healing. People have been walking on injuries that they shouldn't have been walking on. They have not been using the right DME, or they've been put in DME for too long that they shouldn't have been. So delay affects an injury in many different ways than just a delayed diagnosis. And then it leads to overall increased cost, prolonged pain, and dysfunction. This is a big factor for the patient, their family, the mental stress involved, and then disability, longer recovery, impacting overall quality of life. And then an impact of delay, as we have seen, has led to an emergency visit for a lot of the time. Patient is unsure, so they did not know where to go. And they ended up going to the ER because whatever the initial treatment was somewhere else, maybe they didn't get the right treatment, right answers, and the pain is not controlled. And that was an avoidable ER visit. Higher costs associated with it, more mental stress, more wait times, and ultimately, like we mentioned, more fragmented care because they have been seen by multiple different people, multiple opinions, repeating the same imaging, and we cannot get records from somewhere else, or it's not available in time for review, so we repeat the same things done over and over. Administrative burden, inefficiency, patient dissatisfaction, all of that follow, and it just is not the right way to do it. Now, this is an important slide for us and for you as well. Which place do we choose? Choosing the right site of care, right? When you have an injured worker presenting to you, it is important to know where to send them. And you may not always know the right answer, depending on what type of injury. Is it minor? Is it not? But a good review for Injury Express, which is us, an orthopedic specialized walk-in clinic versus the emergency room. Most seem fairly straightforward, but sometimes there's confusion. So that is why this is an important slide to keep in mind and review. So basic sprains, strains, any overuse injuries over time, the worker presenting straightforward comes in, can see us. Fractures, anything that looks fractured, looks broken, or suspected to be broken, send our way. That comes to Injury Express. Any spine, joint, back, neck, any joint that they've been hurting, including small knuckles, anything, fingertip, any injuries or pain, comes to Injury Express. Anything that patient, the employee attributes to work-related, comes to us. Any cuts, minor lacerations, any contusions, they got bruising, even contusion to the head. They hit the head, they have contusion, or anything related to sports, comes to Injury Express. When we do have to mention one more thing here. That would be any eye injuries. If they have any metal in the eye, anything suspected that they're affecting the vision, they can be seen by us. And then we can always make that determination as well. So it does not have to be on the employer side to determine. Sometimes it's not sure. Send them to us. For these, when it's the gray zone, can it be seen? Send them to Injury Express, and we can make the determination if they need to be sent over to the emergency room. We can. Otherwise, when it is straightforward, difficulty breathing, chest pain, injury to the chest. Let's say they had a heavy metal beam hit their chest, and now they have trouble breathing with chest pain. You worry about a pneumothorax or flailed ribs or anything. That is a straightforward ER. Any bleeding that looks arterial, that is severe, and we have some severe uncontrolled bleeding, that obviously needs to go to the emergency room. Any head injury with loss of consciousness, this is a good rule to have. Which head injuries can go to Injury Express, which can go to the emergency room. Head injuries that have loss of consciousness history obviously can go to the ER right away. Anything that you feel is minor or feel is a gray area, like I said, can send them to us, and then we can make the determination. Obviously, any injury or without injury leading to stroke symptoms. If you are injured and having stroke symptoms of face drooping, arm weakness, speech difficulty, that is considered an intracerebral hemorrhage, needs to go to the emergency room. Without trauma is considered a ischemic stroke, needs to go to the emergency room as well. And obviously, severe abdominal pain that automatically needs advanced imaging like a CT scan, needs to go to the emergency room. And obvious one, any life-threatening kind of an injury that you suspect, 911 to the emergency room. Now, why is a specific orthopedic urgent care a good option and can be the right first step for you to send your injured worker? Number one, it's faster access. We have same day evaluation or most to any orthopedic injuries that can be seen by somebody who trained in orthopedic evaluation. And we have the orthopedic expertise. This is what we do. We do musculoskeletal injuries, we do musculoskeletal evaluation, and you get a comprehensive evaluation with us, which we will talk about in a few minutes in detail, including the history, the exam, the appropriate imaging, and every treatment plan is specific to the worker, to the injured worker, and that is personalized, including recommendations of when they return, how they can return, and treatment plan automatically takes into account focus of returning to work and rehabilitation, which might not be available with other non-orthopedic trained walk-in clinics, for example, or even the emergency room. So that is why this is important. If you're sending somebody, send them to an orthopedic specific urgent care like us. The sooner, the better. Now, what do we typically treat? We kind of briefly mentioned, but specifically with regards to joints, any of these joints that you see here, from shoulders to elbows to wrist, hand, spine, entire spine from neck all the way to the lower spine, hip joint, knee joints, ankles, and foot. Now, this ranges from a strain, a sprain, overuse, rotator cuff, tendonitis, bursitis, repetitive stress injuries. Somebody comes and says, hey, I've been working repetitively and I have now some numbness, tingling in my wrist. And they're saying, okay, is it carpal tunnel? We are thinking it's carpal tunnel, but we don't know. Send them our way. This is what we do. And anything relating to the spine, they can be annoying to manage. They can be difficult to diagnose. They can be a lot of factors confounding. Is it from work or not? Send them to us. We'll make the determination. We'll do the evaluation. And we have, good thing with OrthoIllinois is we have the complete package when it comes to specialists. So the walk-in does the evaluation, and then we have each specific body and organ part. We have specialists with us. So depending on the initial evaluation, we decide if they need to go to specialists or can injury express itself, manage, and treat them. So anything that you suspect in any body part that is musculoskeletal, we treat it. Now, this is an important slide to pay attention in terms of an employee is injured at work for you and they're showing up to you. Why is early referral important in some certain specific situations which are red flags? So if you notice somebody coming to you and with severe pain or swelling, if you feel like the swelling does not seem proportionate or the pain does not seem proportionate to what it looks like. Now, we have all come across situations where there is malingering or where there's a situation where the employee doesn't want to be at work or what we call as workitis. But you don't want that to be a red herring there and miss an important injury such as a compartment syndrome. People can have disproportionate pain and it might not look as dramatic. So if there is an injury associated and the pain seems out of proportion to what you can see, still take that as a red flag that needs to be identified for early referral to us. And again, just send them to us directly. Same day evaluation, we can evaluate and see and determine. I just had a patient the last week where we had somebody who had an injury to their hamstring and presented to us. And he presented with features of compartment syndrome in his leg from just that swelling that had gravitated down. He had gone to the emergency room when the injury happened because it was late at night. We were not open. The emergency room put him in a leg splint. For a hamstring injury, he was placed in a lower leg splint. What it ended up doing, all that bruising, hematoma that leaked down, has now created a closed compartment that could not expand. Otherwise, it would have done naturally. And now patient next day comes and is seeing me with features of a compartment syndrome. The good thing he came back and saw us the next day. The treatment in his case, thankfully, it was transient compartment syndrome. We were able to just remove that splint and control his pain with close follow-up. And now, because of what happened, he has been off of the ability to work now for 4 weeks. Good thing he's improving, but it's been 4 weeks. So that severe pain or swelling, always take that as a red flag is the message here. Any mention of instability, giving away, clicking, locking, mechanical symptoms of instability has to be taken as a red flag and to be sent immediately for evaluation. A lot of urgent cares even take that lightly for some reason, and we miss important injuries that can be rehabbed before it becomes surgical. So send them to us early for any instability or weakness. Obviously, number 3, any deformity or suspected fracture, just send them to us, not any brace at work, and rehab or different work restrictions, just send them to us early, even for any possible fracture that might be a hairline fracture. Let us evaluate and make that determination. Numbness and tingling should never be ignored as a minor nerve impingement as well, because sometimes people come in with some injuries and they have vascular involvement and their presenting features are very similar to a nerve compression symptom. So this has to be taken seriously as well, and send the patient over to us so where we can do a full neuro and vascular evaluation and then determine if it's just a neurologic issue or if there's a vascular component that determines more severe injury and further workup. And if, let's say, what presented as a minor injury or minor symptoms, and you have had the opportunity to give them some rest, maybe work modifications, and then it's still not getting better after a few days. Typically, if I would say 2 to 3 days, they are not better with what you have already tried, the over-the-counter meds, the rest, ice, elevation, then send them over to us. Let us evaluate and then determine if anything more needs to be done. Now, a quick overview of what we do when patient comes to us. We follow a protocol for any patient and workman's comp in general as well. But more specifically for workman's comp, we have a protocol as well in terms of what we do. It's a focused history, injury review, any previous injuries that they have had that might have aggravated as a result of this new injury. So that is pertinent, right? So a pertinent history and injury review and a physical exam that is focused as well. And determine if an x-ray is needed, then an x-ray gets done on site. And then the provider walks in. We have a diagnosis that after the physical exam is done, x-rays are reviewed. We explain the findings, educate the patient, and if the adjuster is there or the nurse manager is there, we explain that as well. And then comes the treatment plan, which is a coordinated plan of what the patient needs at that time, be it medications, over-the-counter, prescription, and then a full recovery plan. Now, this going a little bit more into detail, right? I mean, the history component is very important when it comes to workman's comp is mechanism, right? This is sometimes not taken into account. So that is where we pay attention is what is the mechanism? Is the mechanism making sense to the injury being described? That is where we have to see if there has been any prior injuries or conditions that might have made this aggravated because of this new issue. Obviously, the onset, the location, the timing, everything is documented. And this is our staff who room the patient are trained in doing all of that history, and then the chronology of symptoms, the symptomatology associated with time is taken into account when we do a history. And then work duties and demands are also taken into account when we do the history. So this is where it is different, right? So we focus on those components that are sometimes missed. Then, of course, the symptom review, focused exam that we talked about, inspection, palpation, the range of motion, stability testing, that then leads to the decision making for any appropriate imaging. It might look like no imaging at the first visit, if it is soft tissue, if it is minor, versus an x-ray. Look at underlying bone structure, any bone spurs, anything that gives us clues that it might take more time to heal, versus some presentations are unstable injuries that need advanced imaging in the form of an MRI right away or a CT scan, and that'll be ordered as well. Then comes the assessment plan like we talked about, which includes the diagnosis, the treatment plan, the restrictions specific to the work of the employee at his workplace, and then a clear follow-up plan, including a monitoring program, Sometimes it looks like 2 to 3 days follow-up if we want them to just take it easy for a few days and we think it can be rehab fairly quick versus a week, 2 weeks. That is, again, it's all individualized and tailor-made for the specific work injury for the patient. And this we have seen has led to better outcomes in general.
So looks like another good spot for our second keyword, which happens to be injury. We try and make these easy to remember. The second keyword that you need is injury. Again, please do write this down because we cannot remind you later. The second keyword that you need is injury. Back to Dr. Shree.
Thank you. Now, talking a little bit about personalized treatment plan, right? The evaluation we mentioned, we do the thorough history, focused physical exam. We have done the imaging. Now, when we talk about this personalized plan, this looks like for a patient, it might be a short-term relief with medications, bracing if needed. Most oftentimes we have seen activity modifications is the biggest thing. And that is where our expertise of knowing and seeing acute injuries in workmen's comp patients and other patients, we know that the role of activity modifications is underutilized. And that is a big part of our treatment plan as we do activity modifications. We take that very seriously. That looks like work restrictions, work modifications, and at-home activity modifications. Any over-the-counter meds, we try our best to do over-the-counter medications if possible at first, but if they need prescription, that is being done. Physical therapy, we have a big emphasis on physical therapy. That might look like even home exercise program that we can work with the injured employee versus sending them to our own physical therapy centers. The focus is, again, we want to restore their function too, not just controlling their pain. We want to restore their mobility, their function, and their strength and get back to work sooner and safer. Work modifications is a big thing, like I mentioned. And then the follow-up progress is very personalized as well. It is not a one plan fits all. It is very personalized and focused for that injury for that worker. And regular communication and updates. This is where we having a team that includes Bill as well and our workman's comp team itself. We have a dedicated team taking care of the paperwork. If there are any questions for the employee, we are all aligned in terms of, okay, they need modifications, they can come back. We'll reassess them, change anything if needed. This having a whole team behind helps streamline these processes much better. We spoke about this already, but every treatment plan being customized and tailor-made for the specific patient is something that we, again, just emphasizing that is how it has to be done. And then we are very much all aligned, myself and my nurse practitioners or PAs, whoever might be seeing the patient if I'm not there. We're all aligned on this, that every single patient's individualized treatment plan is based on the injury. Now, talking a little bit about work restrictions and returning to work. I've been here 5 years now. I cannot think of a single time that I've taken a patient off of work. Based on whenever we have seen people, we have always worked with the workman's comp adjuster, the employer, to try to get them back to work with restrictions, with modifications. How can we help the employee and the employer where they can still do something? And there are some instances where they cannot do anything at all, that the employer then makes that decision. Hey, with these restrictions, there's nothing that they can do. But we always try to start with work restrictions, modifications. Of course, it's based on the severity. If there's obviously fractures, and then we sit down duties only for somebody who is a mechanic or it's labor intensive, then they're off work. But generally, the goal is to have some type of work restrictions first, and that the employee returns to work safely. And this is, again, made with the employee and the employer all collaboratively. So assessing the injury, determining specific restrictions that are temporary based on the condition, and we gradually have a plan to improve. Our progression is based on their healing, right? So as they are getting better, as they are getting stronger, that is why the follow-up plan we have is tailor-made. It's sometimes 3 days. Then the next visit might be a week later. And we have a goal of if they are 75% or more better, we have the discussion with the patient and say, hey, are you ready to return to work without restrictions? And we always are available. If anything changes, let the employer know, return back anytime. And that seems to work really well with patients as well. The patient satisfaction component is there, knowing that, hey, it's not one and done. What if I have issues? Can I come back? Will I be in trouble? That is where we work with them and say, notify your employer. We're here for you throughout your process of the injury recovery and rehab, and get back to work at your baseline. Now, this is where we differentiate in ourselves, having a team. Like I said, we have that whole team of workman's comp from the moment the patient is being roomed. The staff are trained to take that entire history, accurate history, chronology of the symptoms, and that leads to having all that documented. We have obviously the visit summary that says what all we recommend. That is being made copies for the employer and the work comp adjuster, but also any questions with timely updates. That is where Bill is fantastic. Reaching out to Bill, giving me a heads up. I've had this so many times. Bill will bring me a little heads up of, hey, this patient is coming to see you. I got a message from the employer, and I love that. Having that little heads up means I know what's coming, and I already know what has been presented. So then it just helps me make better decisions for that patient. And that communication, we are very much transparent. We want to be collaborative with employers as well. So we welcome that. We welcome communication and keeping that line of communication open. And there is no such thing as too many questions when it comes to your injured worker, when it comes to your employee. Reach out to us anytime. So the timely updates, we're very big on that, having that transparent information for the patient as well. That this helps anytime they call, any questions they have. Having that information seems to be the biggest patient satisfaction driver from our experience. And then that open line of communication, like I said, just having that, building trust with the patient and having that confidence for the patient that, okay, we are with a good team. Now, what from an employer standpoint should you be looking for in terms of where for my employee? Obviously, you want that employee to be in good hands. You want the employee to have good care, and you want them to get better and recover faster, so they're back at work in a timely fashion and in a safe way as well. This is where making that decision of who they go to see becomes important. Where sending somebody with a musculoskeletal injury, send them to an orthopedic expert who specialize in musculoskeletal injuries and who know how to care for work-specific injuries. That is something that an employer should be looking for. Are they available? Are they accessible? So Injury Express with OrthoIllinois, we are open 7 days a week, closed on major holidays, but otherwise 7 days a week, 8 to 8 during the weekdays and 8 to 2 during the weekend. And like I said, all the staff, all the providers are all trained in handling workman's comp efficiently and follow the protocol that we have in place. That is where the communication, the collaborative approach all comes in, and proven results. I mean, you should look out for, does this place know what they're doing? Do they have good reviews? Do they have patient satisfaction where patients are gone, and do they recover? And do they have the ability to escalate and send the patient to a specialist without further delays, without further drives and travel? And that is where OrthoIllinois comes in. Like I said, we have a full specialist group for any orthopedic injury you can think of. We have the experts, and all of our specialists are also well versed and trained in workman's comp injuries. So that is where we differentiate ourselves. Talking a little bit more about the work restrictions, I felt like this warranted another slide where we approach the work restrictions in a way where we are not just, sometimes we have seen where patient comes in thinking, hey, are you working for the employer? That, hey, you want to send me back? Or that is where we set those expectations with the patient that we are with you. We are here to work collaboratively. We want you to be safe first. So that work restrictions, we tell the patient that this is to protect you and protect the employer. And that is where the restrictions come in. They are tailor-made. There is frustrations with workman's comp anywhere. We've all experienced this, right? We, as employers, providers, everybody has experienced this, and patients, of course. frustrations around different restrictions not being honored, not being respected. So that is where having that work restrictions is extremely important, where we collaborate with the injured worker at first and then with the workplace as well. So we welcome having the case manager, care manager, or come in and be with the patient. We welcome that so that we are all on the same page from the very first visit. So the way we work with the OrthoIllinois is we have the injured worker coming in. Most oftentimes they have the care manager come in during the visit. They might not be with them, but after the visit is done, I tell my staff routinely to, hey, bring that care coordinator, the adjuster, whoever is with the patient, bring them back so I can explain this to them as well and address any concerns, questions, more importantly, recommendations that you have for me, because you are there as a you are there on site and you know what the employee does, you know what all accommodations you can do. So it only helps me to work with you. So that is why we welcome that. The goal is, again, ultimately making the patient be in a safe environment. So having your input is heavily valued. I cannot stress this enough. So if you come in, if you want to come in, it's we welcome that. So we would like to emphasize that again. The work restrictions that we do, we want to always collaborate and with the employee and as in the same way with the employer as well. And they're very individual, very specific. I mentioned this many times, but they have a time specific limitation as well. We typically do that. We try to modify, saying no ladder sometimes, or sit down for so many hours, or may take break as needed. So we try to do as much as we can to be very specific for that employee. And we have seen that whenever we have done that, the more specific we have been, it has helped the employer understand the restrictions better. The employee is able to feel more supported as well. And research has shown that more specific we have done things, it actually has promoted faster, safer recovery without having to do anything more. That is why the work restrictions alone, which again, talking in terms of activity modifications outside of work and work restrictions while at work, has had more effect in treating a lot of musculoskeletal injuries compared to even medications, compared to braces. So that is a big emphasis for us. Now, some takeaways to remember after having discussed all of this is the timeliness, the early assessment when an injured worker comes to you. An early assessment is critical. Then accurate diagnosis is, of course, important. Appropriate treatment plan helps to have the employee return to work safely. And the collaboration, the communication between employers, between our providers and the employees, that's where having that partnership with you is very important for us too. And ultimately leads to better care and stronger results. And having a focused, musculoskeletal focused team with expertise in musculoskeletal disease management, that is where we come in. That is where it helps. So that partnership, again, with you for us is very, very important. With that, I will leave it up to the Q&A session. If you have any questions.
Got it. Dr. Sreedharan, thank you very much for an excellent presentation. We really appreciate you taking the time out of your busy clinic to share your expertise with us today. If you do have any other questions regarding workers' compensation service, referrals, or if you want to learn more about OrthoIllinois' Fast Track program for injured workers, please visit orthoillinois.com and select the Employers section. For employers and claims professionals in Algonquin, Elgin, McHenry, or the greater Chicagoland area, please contact Paul Strandquist at 815-847-7088, or at Rockford, North Central Illinois, and Southern Wisconsin, contact me, Bill Collar, 815-847-7044. Dr. Sreedharan, one of the things that we were talking about off the air before we got started was just the kind of knee-jerk reaction it seems like so many people have in the public. Okay, I hurt myself or I did something, I just need to go to the ER. And there are so many other options. Case managers have nursing training and kind of help direct that. But as the layperson, you touched on this a little bit, but I think it's really important that what are some of those red flags to definitely, hey, if this is going on, this is kind of an ER thing, and this is something that could be an urgent care type of setting.
Right. So like we touched base on that important slide, anything that is seeming like, let's say, crush injury that we did not mention in the slide, for example, that would need an urgent, immediate evaluation. If you're not sure if the crush injury is severe enough, like I said, send them to us first, right? Because again, this is where we are trained to evaluate for a few other things like compartment syndrome with it, nerve and tendon injury. We can expedite things. Versus they've gone to the ER and they say, okay, it's a crush injury, but you don't have anything major going on. Go see an ortho 5 days later. By then, they have had some injuries that now we could have assessed sooner. Simple example, somebody comes in with a laceration that we had. They had cut, it was a laceration. They went to the emergency room. It was a work injury in their finger. They cut their finger, but they also cut their extensor tendon, which was missed. So the patient could not extend their finger. The laceration was sutured and told, hey, go to an urgent care to get it removed after 7 days. So the patient comes in 7 days. By now, he has a full extensor tendon laceration as well, and it's already started retracting.
Yeah.
So his healing is not going to be optimal. So now there is loss of function of a body part too, right? Which is totally something that could have been prevented. So this is where lacerations need a separate kind of an assessment as well, which if you are not trained in it, you will miss. And that is another example. Send them to us right away. Obviously, head injury, like I said, loss of consciousness, no brainer, send them to the emergency room. If the patient is double down in pain from an abdominal pain issue, send them to the emergency room. But even when in doubt, send them to us. And if my staff are trained, if they don't know where they should go, they're trained to contact me, and then I can guide them if this can be seen at IE versus they need to go to the ER. So when in doubt, send it to us. Send it to us early.
This one's very specific, but one that I know that we've seen with some frequencies, especially in our area, a lot of manufacturing, hydraulic fluid injections, high pressure hydraulic fluid injections.
Where depends on the location, right? So yeah, I mean, it depends on how the velocities. There's a lot of factors that you have to take into account. But yeah, when in doubt, send them to us. Let us evaluate. I would put it that way.
Absolutely. Yeah. Between wait times, it's always dangerous to talk about average wait times.
Average wait times in the emergency room, right?
Yeah, average wait times in emergency room ver's
average wait
urgent,
times in
yeah.
Injury Express, probably 2-3 minutes before you're brought back, and then the evaluation, workman's comp, all that process. Our door-to-door time typically is 45 minutes to 60 minutes, even for a fracture that needed reduction and splinting. Yeah.
We've got another question here. It's kind of specific as far as the question is, how is MRI availability for injured workers across locations? Can injured workers get in for MRIs quickly? Certainly, our work comp department is going to prioritize the injured worker and get them in as soon as we can. We have partners for MRI that we utilize as well. But can you speak a little bit about how important it is to get that advanced imaging early as opposed to, well, let's wait a couple of weeks and see?
And this again is determined based on the type of injury, right? Not every injury needs an MRI. Some, as you know, insurance companies require, let's say for a spine issue, you need to have done physical therapy for 6 weeks, and if you have failed, then only we will even approve an MRI, which for some instances are okay. But some instances, it's not. They are not evaluating the patient at bedside. They're not looking and seeing how the patient is. So that is where we use our expertise and determine if the patient has some red flags that is concerning. Yeah, they don't have to undergo physical therapy. That is where we pick up the phone and fight. We get on the phone and talk to the adjuster or talk to the insurance representative. It's another physician for a peer-to-peer. We call and tell them, no, this is why we need this MRI right away, because we are seeing these red flags. So to answer your question, Bill, how important is based on specific organ part? Just like I said, if there is retraction for, let's say, a biceps rupture, that's a big one. You have 14 days before it's repaired for full functional mobility to be restored. So imagine a biceps rupture that was missed, thinking it was a sprain or a strain. Patients sometimes don't even present after, unless it's already been 3-4 days of not getting better. Then we have waited. And we have tried, why don't you try PT? Why don't you try these meds? We have lost the optimal window for recovery. So it's extremely important for specific injuries. Biceps is a big one, right?
Yeah.
So Yeah, absolutely.
And it helps for causation as well. Causation is something we've talked about a lot, and it's on the mind of everyone that is listening to this webinar right now. Is what's the causation? Is this work related or not? That we're always going to focus on that, but having that advanced imaging really can help hone in on that, right?
Correct. It ultimately is a tool that is going to help everybody, the patient, us, and the employers. Like Bill mentioned, the causation is very important, right? Sometimes you cannot determine if there's an underlying issue that was aggravated. Is it an old injury that now they're trying to get it covered? And so that is where having that MRI determines, is it acute? Is it not? We get clear signals. So advanced imaging is your friend, is a tool that helps everybody. So when we determine we need it, it's something to answer the question of the poser there. We can get it done fairly soon. We have a team that provided the authorization also happens. It can be done fairly soon.
Um, any other questions? Please use that Q&A section. Again, we've got a little bit of time left, so if you do have an additional question, please put that in there. Do you have some other questions, kind of regarding the work return to work restrictions? Obviously, you talked about that being very personalized. What are some things that an employer might be able to provide to you that can help with that decision?
Yeah, great question. This is where, like I said, having a little heads up note sometimes that Bill brings me occasionally helps. It tells me what the employee does. So having a job description, what the employee does routinely, helps us significantly before we even walk in the room. It gives us an idea of what he does, and does it pertain to the injury? Is the story matching? So we get a lot of information from that. So that is a good thing if employers are sending patients to give us an idea of, hey, a little synopsis, a little summary. It might not work all the time. If it is straightforward and fairly straightforward, we don't even need it. But whenever you suspect an overuse type of an injury concern that an employee is bringing to you, please send some information to us. Whenever there is a chronic issue somebody is bringing to you saying, hey, it's been going on for 6 months, having that little heads up always helps us. If an employee has been to other urgent cares, other walk-ins, other workup has been done, having that heads up helps, that they've been to multiple different places, so that now they're coming in after trying this, and this to you. So before we walk in, having those information help significantly.
What are some best practices that employers can implement to improve that communication? So, if you were king for a day and you could have an employer do a few things that would help you, what would be some of those suggestions?
Other than reaching out to us, right? Whenever this an injury happens, I know some companies do that routinely. That we get a heads up, we get notification from them that an employee is coming. Um, Best practices for you is documentation. Documentation is the key, which should be in your protocol already. But document everything. Whenever the worker mentions it, even if you're trying something that is very simple, that you think it's a small injury, I'm just giving work modifications, document it. And that, because that is a treatment too. So it's always best practice to document anything that you tell the employee. And that is where, in the beginning, if you send them early to us, we have everything documented too. So, yeah.
Yeah, and that communication is so important. Every provider seeing a patient, whether work related or not, you are only as good as the report of what happened. And kind of like reporting an accident to the police, the recollection at the time is not always completely accurate, and so it can take a while to sort of sort through that, right?
Yeah. And we have challenges, right? I mean, sometimes people come in with injuries that have been there for a year and a half. They've
Right.
gone to so many different people. Now an IME is in the works. So it's very, very challenging workman's comp as it is. And as we know, a lot of people don't prefer to do workman's comp anymore.
Yeah.
So it's very challenging as it is. That is where having that collaboration from the employer side, letting us know, giving a heads up, it's very helpful. Yeah.
Well, and the expertise that you talked about, certainly, your expertise as an ER physician prior to coming here, but having all of our, OrthoIllinois orthopedic specialists, their cell phone numbers to say, hey, can you take a look at this? Is this making sense? Let's get some of that advanced imaging, look for things like fatty atrophy, look for some of those things that can be more chronic as opposed to acute.
As opposed to being acute, exactly right. And that's where, right, I mean, we can just pick up the phone and say, hey, help, take a look at this. It doesn't make sense to me. What do you think? And that is where having that specialist on speed dial, if you will, that helps us too. Yeah.
For those of you who have not scanned that QR code yet, this is your last chance to get any questions in. If you do have any, scan the QR code. Make sure you get in to fill out that evaluation. Again, I will send out all of the evaluation or all of the continuing education credits on Friday. Do want to let you know, too, I should have mentioned this earlier. We really enjoy doing these webinars, putting on this type of communication and education for our work comp audience. We do have one more that we're working on for this year. I can't tell you a whole lot about it yet because that is still in the works, but we have one more this fall. Everyone that is on this call, we are going to make sure that you get an invite for that. These are always free. It's a great way to get continuing education credits. And again, putting a face with the name, learning a little bit more about the providers that are seeing your patients really, really helps with that communication. I think there sometimes is maybe I don't want to necessarily say a fear, but maybe a hesitation. Oh, I don't know if I really wanted to reach out to the doctor.
No, yeah, I mean,
it helps.
We're a very busy practice, but I'm always available. Bill can say that, attest to that too, that if you want to reach me, you will be able to reach me. And as busy as we get, it's helpful when we talk to the employers, so we welcome that.
I do have one provider. He doesn't work in this building. That when I'm standing in the treatment pod, he sees me, and his first question is, "What did I do?"
Yeah,
That's not always the case.
Right,
I'm trying to
Bill doesn't always
facilitate
mean
communication.
Yeah.
Any last questions? This is your last chance. Thank you so much, Dr. Sreedharan, for taking your time.
Bill. Yep. Thank you, all attendees, for taking the time out. And please do fill out that evaluation. It helps us to provide better content. Whatever you have, recommendations, suggestions, please do. Thank you again.